This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on 9TV. The Ebola outbreak, one of the biggest international health concerns that has plagued the world over, particularly West Africa.
It happened in a small town. The name of the town is Yambuku. They found out that people were dying. So people were having flu-like illnesses, and then they would eventually die, and it became an epidemic. And they found out later on that it was Ebola.
The Ebola virus first came into the public sphere in 1976, after a string of outbreaks in Sudan and the Democratic Republic of Congo. As of December 1, 2014, there have been more than 16,000 confirmed or suspected cases of Ebola in Guinea, Liberia, Mali, Nigeria, Senegal, and Sierra Leone, with more than 5,900 fatalities. The deadliest Ebola outbreak recorded in history, according to the World Health Organization. In a recent interview with CNN's Christian Amanpour in July of this year, Dr. Peter Pio, one of the co-discoverers of the Ebola virus, could not believe the extent of the outbreak.
I am surprised, and it is true that this is unprecedented for several reasons. One, first time in West Africa that we have such an outbreak. Secondly, this is the first time that 3 countries are involved. And thirdly, it's the first time that we have outbreaks in capitals.
With its potential to spread in the global scene, the rest of the world has taken notice.
Sa Philippines, wala tayong case ng Ebola. Since August, nagkaroon ng repatriation yung mga OFWs, and the testing has been done sa RITM. So far, we've received 23 specimens. All of them were negative.
Efforts have been made even in the Philippines, where information dissemination has been prioritized together with further education and training on how to handle and manage those who may be infected with the disease. How is the Ebola virus transmitted? Is the Philippines prepared to deal with this kind of virus? All these and more tonight on MedTalk. And joining us tonight is Dr. Anthony Leachon, President of the Philippine College of Physicians and an internist cardiologist at the Manila Doctors Hospital. Also with us tonight is Dr. Minerva Kalimag, President of the Philippine Medical Association. You may join in the discussion by calling our hotline at 548-4678. Good evening, doctors. Welcome to the show. Welcome to MedTalk.
Hello.
Hello.
Our topic for tonight, the Ebola virus, very timely because there were 137 U.S. peacekeepers who are now allowed to see their families. So, eksakto lang that we're going to learn more about the virus, and you're going to educate all of us on the Ebola virus. Let's start off by asking, what is the Ebola virus and what are the characteristics of this type of virus? Let's start with you, Dr. Avery.
We actually talk about the Ebola virus disease because that's what we're going to see among our patients if they do develop the disease. And this Ebola virus actually fast-growing, fatal disease. No? So what do we see? Patients can develop actually just flu-like symptoms, parang sore throat, lagnat, and then after that, they can progress to having vomiting, diarrhea, and then eventually develop yung hemorrhagic type manifestations. And that can be fatal. Yun nga yung sinasabi natin.
Yung
Mabilis siya.
mga na-mention you, Doctor, are the symptoms
Yes.
of one who has the virus already in their
Yes,
system.
yes.
Dr. Tony, the characteristics of this virus, why is it a rapid virus? Why is it very fatal? Wala man lang siyang, unlike the AIDS virus, no? The human immune.
Iba-iba kasi.
Iba-iba ang virus, no? Iba-iba ang strain.
Yes.
What is it? What is that virus that is very deadly? What is in it?
It's an evolving disease, and since 1976, no vaccine has ever been discovered. So for almost 37 years, despite advancement in technology and in medicine. Well, you get it from body fluids transmitted by bats or fruit bats, chimpanzees or gorillas. And then you get affected by these body fluids, either feces, through diarrhea, tears, saliva. Right. So the first classic case, the patient 0, December 1, 2013, a 2-year-old kid in Guinea, ate a fruit laced by saliva of a fruit bat. And then he died. This kid died after 4 days. And then the mother died after 4 days. Then the sister and the grandma, all in 1 month. And then during the burial, the Africans,
Yes.
because of course the condition, the sanitation and everything. So this was the start of the second outbreak after 1976. So that was it. So it spread from Guinea, Liberia, and then Sierra Leone. And at the latest, last week, you have then Nigeria, but Nigeria is out, has contained the outbreak. But the latest actually is Mali. So they're actually following up on Mali right now.
Okay. And following up on all these areas or all these countries that have, or that the virus is very active, no, in all of these countries, and a lot have died because of this virus. What other characteristics of this virus should we know or should we be aware of?
Right. Ang development is basically a flu-like manifestation. The first one, the first kid, nagkaroon, black stools, vomiting, then diarrhea. Then you will have bleeding and multi-organ failure. I mean, say you can have liver failure, then kidney failure. And then you have characteristic bleeding in the skin. So this is really, I would say, very frightening, nakakatakot. Isipin.
Immediately yan, agad-agad mong makikita.
Well, 21 days, but usually the symptoms, because of the viremia, mabilis yung viremia niya, 8 to 10 days. But the incubation period is about 21 days.
Okay.
The WHO says that
So, ang
98% will be 21 days, 2% yung outliers ang tinatawag, beyond 21 days. So it can be 21 to 42 days.
Okay.
Right.
Kasi dun sa 21 days, pwedeng asymptomatic, no? Pwedeng walang lumabas na symptoms na kahit ano, with what you've mentioned.
Oo.
Right. So yung incubation period is important. So the magic number is 21 days.
Okay.
But the peak in terms of the viremia, yung pagpasok ng virus mo, to develop the symptoms, actually 8 to 10 days. So gusto lang natin linawin to the audience, hindi siya nakakahawa kung wala siyang symptoms. Deadly lang siya kung meron ka ng symptoms at all. May lagnat, meron ka mga secretions. Right.
Pero,
dapat linawin
So,
yan.
ang malinaw dapat, you cannot spread the virus if you do not have the symptoms.
Exactly.
Yes, yes.
Unless otherwise, you will deny it in the first place.
Which brings us to another point. Yung sinasabi natin na truth saying.
Okay.
'Di ba? Kasi kung galing ka sa isang lugar na infected, alam mong may infection doon, tapos pupunta ka sa Philippines, halimbawa through another port, hindi ka diretso coming from
Let's say Liberia.
Oo, 'yon. Halimbawa, dadaan ka sa ibang country, tapos ang i-declare mo kunyari galing ka doon sa second country or doon sa hindi galing sa kung saan ka ng initially na Liberia. So, pagka ganon, and wala ka pang symptoms, pwede ka ngayong makahawa sa iba once you develop the symptoms. And problema doon, akala mo lagnat-lagnat lang, di ba? Yung mga mga non-specific symptoms of
Yeah.
a viral disease.
Kasi you can also mistake yung lagnat or inuubo kasi pagod ka eh.
Right.
You've been traveling for a long
Right.
time.
Yes,
Diba?
yes.
So yung classic example, dalawa. Let me give you two
Yes,
examples. The first one is Patrick Swayer. He was in Nigeria en route to Minnesota. So yun ang connecting flight niya. But it so happened, nag-collapse siya doon. Nung nag-collapse siya, yung pala may Ebola siya, then nakahawa siya, so namatay siya. Imagine, on board na siya sana to a connecting flight. Then the classic example is Thomas Eric Duncan.
Yes, the first
one to die in
of the
America.
Ebola.
September
Yes.
15, he helped Martha Williams to go to the hospital bilang driver siya, personal driver. And then he was booked pala to go to the US, to Washington, September 19. He denied na galing siya to the connecting flight. Then he arrived September 19, but developed symptoms September 24. So he was in Texas then with 5 kids and wife.
Yes.
He was he consulted the Texas Presbyterian Hospital. He denied again. So he was sent home with medications. And then come back. So he came back September 28. Doon nalaman Ebola. But he died October 8. So about 23 days yun. So that's the problem with a system na you can deny their symptoms, lalo na Filipinos, let's say you have 3,000 workers there and 10 million migrant workers. I think we are number 2 in the world, second to Mexico. But our problem here is that, to me, you have here a system where our airport system may not be as rigid as the first world countries, and you have many portal of entry, NAIA 1, 2, 3, and you have seaports, and you have Cebu. So that's the reason why
Very
it's very
porous ang
difficult for
ating
us to
borders.
control it
Okay, so
at the ground level.
So before we can control it at the ground level, responsibility of the passenger or the Filipino who has come from working abroad. It starts from him, no?
Oo.
To be honest, na i-reveal
Let's
niya
say.
yung kanyang point of origin, and then protocol follows.
At
Na
saka
when
kasi,
he arrives,
at saka kasi mahirap mag-contact tracing, no? Pagka nakalabas ka na sa
that's true.
Yeah.
sa community.
I've learned by reading there are 3 reasons why we fail in health. The first reason is ignorance, so education is key, and that's the reason why we are all here.
Yes.
The second is about ineptitude. Knowledge
Wala kang
exists,
ginawa.
but we fail to apply it correctly. Right? And the third one, which is important, we fail to set up an environment where we can actually control, let's say, the entry of a virus. So I think that's the spirit behind the quarantine.
Okay.
Because if we will just base ourselves on the experience of the US, they don't have any quarantine, right? Okay. And yet they suffered a lot with 1 or 2, and then another Dr. Craig Spencer.
Yes, who took
Now,
the
but let me
rain even. Doctor, before we talk more about the quarantine and what the difference of the quarantine is to isolation, we'll also talk about what happens to the virus during the 2 to 21 day quarantine, as we've mentioned. We'll talk more about the Ebola virus when MedTalk returns. Did you know that close to 3,500 Filipinos are currently working in 3 West African countries severely hit by Ebola? According to the Department of Foreign Affairs, there are roughly 1,979 Filipinos in Sierra Leone, 880 in Guinea, 632 in Liberia, including 148 peacekeepers for the United Nations. We're back here on MedTalk, still talking about the Ebola virus. Doctors, before we cut to a break, we were talking about the 2 to 21 day quarantine period.
Incubation period.
incubation period. And from what I understand, one of the 137 U.S. peacekeepers, one developed a sore throat and one developed a fever. So
Right.
please tell us what happened to both peacekeepers. How did you proceed with that 2 to 21 day incubation period?
The first patient, the first peacekeeper developed fever, and then he was transported to RITM. Turned out to be malaria because Africa is also endemic for malaria. The CDC guidelines is that when you develop malaria, when you develop fever, even without malaria testing, you have to give medications right away.
Okay.
Right, so that's the guidelines. But they tested this patient also for malaria, and they also tested for Ebola. Negative for Ebola, positive for malaria.
Okay.
And then after treating the patient for a few days, the patient was transported back to Carvalho Island to finish the quarantine
period.
at the Carvalho Island. The other one
okay.
developed fever, was isolated in a tent, but it was benign and joined the rest of the group.
Okay, so quarantine and isolation, sometimes
They're two different
nakakalito
things.
din siya, no? So quarantine,
Pag wala ka pang symptoms.
okay.
But once you develop the symptoms, you become, tinatawag nila na wet case, then you are supposed to be isolated. So dun sa isolation na yon, meron kang sarili mong commode or ano, and then all of the things you do are by yourself.
So ikaw lang
Para
mag-isa,
hindi-
you're
para
not with a group.
Yes, para hindi ka makahawa sa iba.
Okay.
Pero Angel, alam mo yung quarantine, when you research on that, na-derive siya sa Italian word na ibig sabihin 40, 40 days.
40 days.
In 1377, yung bubonic plague na wipe up 300,000 of the people in Europe, yung sa rats, remember?
Yes.
Sa rats.
Right.
Yes.
So, ang ginawa ng mga leaders noon, they will not allow yung mga sailors na bumaba ng shore kung walang 40 days. Doon na uso yung quarantine.
So lahat sila nasa ship
Na ship, oh.
for
And
40 days.
well, healthy individuals, no? Ang quarantine healthy individuals, and then during the incubation period, let's say yung bubonic plague 40, ito 21 days, wait and see muna ikaw whether you develop symptoms. So after the last day of the 21st day, you'll be released na. Ang isolation, sinabi ni Dr. Kalimag, pag nag-develop ka ng sakit during the quarantine, you will be isolated, so you will not infect the rest of the quarantine group.
Is this a global guideline na may quarantine and then isolation?
No. The Philippines kasi is a presidential and a cabinet decision to quarantine. And perhaps the spirit of that is that sa Africa, you have exit screening and then quarantine ng 21 days and then blood tests for Ebola. And then you fly out. Here, siguro, tinutugon ng presidente and the cabinet is the 2% outlier na some patients will develop Ebola after the 21st day. Ang CDC, WHO, at saka yung experts ng Philippine Society of Microbial Infectious Disease adhere to the WHO guidelines na wala na dapat quarantine. Then, o-obserbahan lang ka lang kung nagkaroon ka at the point of entry. Kumbaga, tatawag ka sa hotline nila kung nagkakaroon ka. So, yun na yung guidelines nila. Kasi sinasabi nila, after the 21st day, hindi ka na nakakahawa kung na-quarantine ka doon. Pero ang pag-aaral sa Lancet, October 21, ang sinasabi ay, for low-income countries and middle-income countries whose infrastructures in health are basically different from the first world country, it's better you do all of these necessary preventive measures rather than address that at the entry level. Kasi one pa lang out, according to Dr. Desi Roman, nakinig ako sa lecture niya, one case pala, 40% will turn into outbreak. 5 persons na develop in cluster will develop 90% in major outbreak. So, ang Canada, medyo rigid sila. Travel ban, in and out. Hindi ka paparatingin, hindi ka rin pupunta. US, iba sila. Wala silang quarantine, only 8 states lang. So, perhaps it's customized to the needs of a particular country. And since it's an evolving disease, nag-iiba ang guidelines mo, depende sa preparation mo at the ground level.
Okay. So what?
And
Yes,
also
Dr.
because I think ang decision ng ating president and the cabinet is it is much cheaper to prevent the disease rather than to treat kung meron ka ng outbreak, 'di ba? Considering na yung ating infrastructure, health infrastructure is such. So
preventive measures ang
Oo naman.
directive,
Oo
so to
naman.
speak, no?
Right.
So you've mentioned na the needs of each country, iba-iba yan when it comes to
Yeah.
addressing
Yes.
or yung protocol needed or even quarantine.
Yeah.
That is needed for
Yeah.
for someone who has come from
Yes.
these countries na with the Ebola virus outbreak, no?
Yeah.
Ano ang needs natin here in the
Right.
country?
Alam mo,
Doctor?
Angel, nandun tayo sa needs, no?
Yes.
This morning, I was able to listen sa radio. And then, this afternoon, may mga nagtatampong OFWs natin, kababayan natin, but sila ika-quarantine after nung quarantine nila sa Africa. Ang point na sinasabi kasi, in-invoke ng President noong November 7, yung Quarantine Act of 2004, that you have to do this in the interest of public safety. So, hinihingi ng Presidente is patience and sacrifice. Hindi sa nandidiri ka or what, no? But it is also for the families then of the OFW and the entire country. And they are, of course, regarded and recognized as heroes. They're heroes in the first place. Kaya lang, ang sabi niya, pauwiin natin sila rather than magkasakit sila. And that's the basic reason for the quarantine.
So
at saka mas mahirap nga kasing likumin kapag nakalabas na sa community. Rather than ito, diretsong galing ka sa isang lugar na alam mong potentially infected sila, mako-contain mo talaga yung disease. Diba?
dapat talaga maintindihan nila yon, ano?
Oo,
and,
yun.
and their family should understand.
They have to
that as well.
sacrifice
Oo.
para din sa pamilya nila yun eh.
I remember an advertisement from the DOH, ang hindi pagkonsulta nakamamatay.
Right.
So talagang for your own peace of mind and your family's peace of mind, there are certain protocols that should be followed.
At
No?
saka nakatiis na sila, di ba? Nag-UN peacekeeper sila ng matagal.
Pero excited sila di ba? Parang hindi mo na
Parang
mahirap the emotion of...
nandito na sila, pero hindi pa rin nila
Oo, yung parang pigil pa rin. But you know what? Since nandito na rin sila, di ba? And the directive is preventive measures. Are we prepared to handle the Ebola virus
hindi natin
in the
alam.
advent?
Well,
hindi natin alam, no, Doc? Hanggang nandyan na
Yeah,
yung virus.
honestly, I don't think any country is ever prepared.
Okay.
Kasi for 37 years, wala nga vaccine
Oo,
na
di ba?
na-develop.
Bakit
Right
ganon?
now, they're scrambling right now, no? Okay. One is, well, it's political in nature. This is the first reason. Kasi, sometimes, drug companies or pharmaceutical companies will make, of course, products that will actually attract the big markets, di ba? And number two, I think the United Nations has said this, that medyo anemic yung response of the other countries, the first world countries. And you need 100 billion really to stop an outbreak. So that's why medyo United Nations Secretary General Ban Ki-moon and even Director General Margaret Chan, nagtampo siya when the first world countries and even other countries, in terms of human resources and funding, kulang. You need money here. And according to them, the only way to stop that outbreak is basically to attack at the point of origin. Pero ang problema nga, during the first time na tinawag kami, PMA and PCP, whether you would like to go to West Africa to help, ang unang question ay wala naman kaming training. And then, that's number one. We have never seen an Ebola in our lifetime. Ang inisip, of course, is safety. There's a saying na charity begins at home. We're not even prepared, no? So these are things na kailangan maintindihan ng world I think to whom much is given, much is expected. I think the first world countries should be able first to step up for the rest of the world, while the low-income countries should be able to defend themselves muna so that the outbreak will not be spread to the low and middle-income country. Basically, the problem in Africa is about poverty.
At saka culture din.
Culture and
You
sanitation.
mentioned nga yung the burial rights, no?
Yes.
Doon
Right.
talaga nagsimula
Ang ano nila kasi
pwedeng ma-spread because of the tears that are shed during the burial rites.
They have to
The
wash
ground,
the dead.
they have to, yes. They have to
Tapos
touch
they have
the
to,
dead.
yun
The
nga, they have to be
handling,
the one to bury. mga
The
ganun.
lack of soap or water.
That's true.
So these are concerns And basically, yan ang Yan ang problem. Even HIV, nag-umpisa yan sa Africa. So all of these infectious diseases na exotic would actually emanate from poverty and lack of sanitation.
So, the lack of sanitation in the country, we're very cautious and careful, with the directive how to wash your hands, how to sanitize when you're at home, when you're out. What measures are being taken by the government and medical practitioners to keep the citizens safe from the virus? Doc Irene?
Actually, education. We at the Philippine Medical Association have actually come up with disaster management to include how to address in case an Ebola outbreak comes in. Pero ang importante nga is yung the education of the public. Kasi sabi nga natin, prevention muna.
Ako naman, I think we must acknowledge also the leadership of Secretary Ona. He started with directives, yung mga guidelines as early as I think August. And then on October 10 this year, he led, of course, a multi-sectoral effort that started all of these things.
October 10 ba yun?
October 10th. I think it's somewhere here in the Crown Plaza. Nagkaroon ng ganun. I think we must...
So parang all sectors will be able to talk to each other because parang effort mo concerted.
On one page, tapos unified ang approach. I think the government right now has stepped up to the plate right now, considering yung December 2030 naman nangyari. And I think we must actually highlight here the efforts of the government to continue. Hindi tayo magiging perfect, of course, but I think the efforts on the ground level, ginagawa nila. But while we're preparing at the ground level, in terms of the curative approach, so the government is doing the quarantine to prevent it from coming to our shores.
And ground level, our kababayans coming home for the holidays, how prepared are the airport facilities? How prepared are the ground staff? Are there doctors on board? Just to make sure that each and everyone who's coming home is safe, is in good health. What are the measures being taken?
I think nag-step up ang airport. Kasi before na nakikita natin, medyo lax din before, no? But makikita mo ngayon efforts and nakikita mo rin yung OFW na dumating, sinabi kagad, pinigil siya kagad ng quarantine. So basically, nakikita natin yung efforts of the government to really contain. I think meron 5 na dumating na peacekeepers and then may dumating na 14 OFW. So dinala sila sa Bureau of Quarantine. I think ang government right now is prepared to handle the influx of our OFW this coming holiday season.
So the government, the medical practitioners, as well as the citizens, hand in hand. Diba? It's a team effort to educate the public and to educate also those who are coming home as well as their loved ones on the protocol that must be followed dito sa country. Kasi as you mentioned, iba-iba ang protocol sa iba't ibang countries. So sundan natin yung atin dito.
On the horizon.
Saka isa pa yung dapat anuhin natin na meron pa kasing pinifill up once you come into the country.
Yes.
And they have to be
Honest
very honest again. Honest about yung mga information na ilalagay nila dun sa ano na yun.
Sa
yellow
form na
questionnaire.
And in being honest, in giving information, educating, we will continue to do that as we talk more about the Ebola virus when MedTalk returns. We're back here on MedTalk, still talking about the Ebola virus. You may join in the discussion by calling our hotline at 548-4678. Doctors, is there a protocol to be followed if a person has been identified with Ebola-like symptoms? For example, a fever. So sa airport pa lang, when they're scanned.
what should be done? Ano yung, kumbaga, SOP?
I-isolate siya kagad and then susunduin siya. Dadalhin siya to the areas RITM na identified and then before San Lazaro and Lung Center.
Okay.
And of course, yon. And then may hotline 711-1001, 711-1002. That's the DOA's emergency hotline for Ebola. So yun ang protocol. Okay.
Doctor?
Meron din kasing mga, like let's say, triage areas.
Okay, what exactly is the triage area? Because I was at one of the hospitals last week, over the weekend, and I saw like, how do you call it, banners that if you've been to these countries, Mali, Sierra Leone, Republic of Congo, you have to proceed to the triage tent, and there's a protocol that has to be done. Ano eksakto yun, Doctor?
Actually kasi, nung nagkaroon tayo ng AH1N1, nagkaroon ng mga triage areas. So, halimbawa, meron kang iniisip mo na ikaw ay suspected na may Ebola. Sa halip na pumasok ka sa main emergency room, you go through a side area, which is a tent usually, kung saan ini-examine ka for infection. So, if you're infected, then you will be brought to the RITM for definitive diagnosis. Kasi doon, kukuhanan ka ng blood.
Sa triage tent pa lang or sa RITM na yan, Doc?
Usually, ita-transport ka sa RITM kasi that's where the test will be done.
Let me give you a solid example.
Okay.
So I work at Manila Doctors Hospital, so we had a briefing 2 weeks ago. There are clarity of ideas and simplicity. If you are a traveler or OFW who came from West Africa, Sierra Leone, Liberia, and Guinea, and then you develop flu-like symptoms, you go to the triage, and then they will call the hotline of the DOH, and you will be transported.
So nothing happens inside the triage? Walang test that is conducted? Do they take your temperature? Wala. Basta, kumbaga, naka-isolate ka?
Naka-isolate. Basta ang key dyan,
Kukunan ka din ng temperature.
Siyempre, kukuha na ka ng temperature. So when you go to RITM, meron na silang basis.
Naka-PPE sila, meron sila doon, but definitely they will not treat it inside the hospital. Kasi you don't want the virus to spread to the private sector and hospital. So, ang sabi ng Department of Health, may triage ka doon. Ang key dyan, West Africa ba kagaling, 3 countries. And then may flu-like manifestation ka. And then, they will take your vital signs, of course, using their PPE. And after that, ita-transport ka na sa designated centers na inalat sa iyo ng Department of Health. Yun ang protocol.
So further diagnosis,
Yes.
tests. So nagaling ka na sa triage. You're brought to RITM. What happens at RITM? What are the tests that will be done? And then
Dalawa
diagnosis?
kasing test yun eh. Yung PCR at saka yung ELISA test. Yun, to determine kung yung bang virus na nakuha mo ay talagang Ebola.
Okay.
So pag negative yon, then you'll be tested for other, sa kagaya nga yung malaria, kasi endemic din ang Africa for malaria.
About dengue? Parang same eh, hemorrhagic din eh. So
Right.
you can also have the dengue-like symptoms.
But,
Pero
you know,
wala kasing dengue sa Africa.
Wala. Okay.
Hindi.
Dito muna nakuha.
Pwede rin. Baka dito.
Baka dito na.
The Philippines kasi is endemic
Baka
for
dito
dengue.
mo nakuha.
Okay.
So what I'm saying right now, you go right now for kung anong killer disease. You go for Ebola kung West Africa. Kasi sanay tayo sa dengue. Almost every day nakakita tayong dengue.
Oo. Kasi from the protocol na hindi mo sinabi yung point of origin mo, so
Exactly.
hindi mo matitrace eh.
Ang clear dyan, unang tanong mo sa TRIA, kung ikaw ay responsible citizen, I came from West Africa, yun ang una mo sasabihin, then may flu ka. So responsibility mo, i-report ka agad yun kung may flu-like manifestation ka. I think responsible citizenship yun ang kailangan.
Responsible citizenship, a responsible government in giving the information, a responsible healthcare worker. We'll talk about yung suit na kailangan at
Right.
ito yung how does the healthcare worker protect themselves kasi they'll be the ones to conduct these tests, no? But before that, doctors, we have a caller on the line, Antonio Menor. Good evening, Antonio.
Good evening po, ma'am.
Good evening. Yung question mo, please go ahead.
Gusto ko lang po itanong kung halimbawa may nakapasok na hindi naman nagpakita po ng symptom, tapos meron siyang virus na in a way, sa skin, sa damit, sa maleta, or somewhere na dala-dala niya. Is it possible po na makapag-survive po ba yung virus ng mas matagal sa quarantine period? Sa kasakali. Saka yung pong kung halimbawa po, nakalusot yun, paano pong gagawin natin?
Salamat, Antonio.
Pag naka-quarantine na Antonio dito sa Pilipinas, nandun na siya sa 21 to 42 days. So, ibig sabihin, the likelihood na meron siya, mababa na. Right. At saka kung wala kang symptoms at all, hindi ka nakakahawa. Nakakahawa ka lang, Antonio, pagka meron kang symptoms na umuubo ka, meron kang diarrhea. Right. So, oras na lumabas ka kasi ng quarantine area, tinetest ka pa uri for Ebola doon bago ka ilabas talaga. So, yung mga peacekeepers natin na umalis ngayon, kasama yung family, na-test na yun at talaga garantiya tayo na talagang yun ay mababa na ang probability na meron kang Ebola.
Okay, Antonio. Doctor.
May
May
tanong
dagdag lang
yata
si
siya na kung halimbawa yung mga gamit mo,
Oo, like sa maleta,
nasa
mga
maleta
damit.
or ganon. Ang nakakahawa kasi are the wet, so yung wet lesions. So kung halimbawa na nasa damit mo, basa or whatever with infected material, yun ang nakakahawa. Pero otherwise, hindi naman siya mata-transfer kung dry.
So kung wet, tapos sinabi nga ni Antonio na sa loob ng maneta, magha-hibernate doon yung virus. And when you get to the country, pwede siyang mag-spread via that wet piece of clothing.
Pero usually, hindi ka naman magaganon kung infected ka na di ba?
Yes.
Hindi ka na makaka-travel in the first
Hindi
place.
ka
That's true.
makaka-travel.
Hinang-hina ka na.
Doon pa lang,
That's true.
hindi ka na makakalabas ng Africa.
Antonio?
Apo.
Oo, may tanong ka pa para sa mga doktor natin?
Yun lang po siguro. Siguro po next na mag-isip ako ng ibang tanong.
Sige,
Thank you po.
salamat. Thank
Sige
you.
po.
Doctors, we were talking about being a responsible traveler, being the government being responsible in educating the public. How about the healthcare worker? What is the responsibility in caring for
bigyan
these?
natin sila ng datos. Ang una nahahawa actually healthcare workers. Doon sa Africa, imagine, 500 yung healthcare workers na affected, 300 ang patay. So, ibig sabihin, ganun kagrabe yung sa healthcare workers. So, dapat ang protektahan nila. Si Thomas Eric Duncan, nung nandun siya sa Texas, nahawa niya 2 nurse despite naka-PPE, naka-personal protective gear. So, ganun kagrabe. So, yung mga sinusuot niya, siguro di-discuss sa yun ni Irvie, dapat talagang protected ka.
Dati kasi may mga iba-ibang parte yung suit, So, nakasuit ka, plus meron kang gloves, tapos meron kang headgear, tapos dati may goggles pa. So, ngayon, sinimplify na nila yon. Bali yung headgear mo, isang buo na lang, para pagtanggal mo, the last piece na tatanggalin mo actually yung headgear, at saka yung pagtanggal mo kasi natanggal mo na yung gloves and everything. So,
May boots ka pa.
Ito, we have video showing or demonstrating how to
Dapat trained personnel, by the way. Bago ka maging healthcare worker dyan, dapat nag-undergo ka ng training ng Department of Health. Nag-conduct sila niyan last week ng October sa mga designated areas. So you cannot be a healthcare worker dealing with an Ebola.
Ayan yung sinasabi ko na
wala nang goggles.
wala nang goggles. Kasi yung sinusuot ngayon, diretso na parang merong transparent na area sa...
Is that okay na wala nang goggles? It's just
Hindi, so ngayon, kasi ang dati, ang nahahawa, halimbawa yung,
Oo.
Dati
In the
kasi yung
middle.
may goggles na ganyan, yung kamay mo, meron ka pang konting infection, pumasok ngayon sa mata.
I think that was yung kanina palm Kaya binago nila na
Yan na ngayon.
one-piece headgear na lang.
Para
Rather
isang
than
tanggal
goggles ka. Kasi kunyari, nangati ang mata mo, you can actually insert your finger into the goggles.
Yes.
So if you have one like that na, may hirapan ka na kahit mangati ang mata mo, you cannot actually enter through
Kasi
that particular
pwedeng
area.
sa mata, sa conjunctiva, o kaya sa
Or-
mucous membranes.
Or pag pinawisan ka, you take it out. Tapos, di ba, you're infected. Kasi parang trial and error also the suit, no? You have to find the right suit to for you to be protected. Kasi
Right.
you want to care for these patients properly with keeping in mind also na kailangan healthy ka.
Protected ka din.
Protected ka rin. No?
Ang dapat nating emphasize dito, I think, you must actually go to the RIPM or to the centers designated by the Department of Health. Kasi all of the sophisticated PPE are there and the ones who are actually trained are these people.
Nandoon.
And that's the
Okay.
reason why yung mga private hospitals, i-refer nila kaagad. Kasi they don't have the capacity and the knowledge, of course, to handle kung wala kang nag-undergo ng training. And that's very important. So we must actually highlight here yung grupo ng Philippine Society of Microbiology and Infectious Diseases
Okay.
na under the PCP and under the PMA yon, sila yung lead
SMID.
group. These are very intelligent and competent doctors nakatulong ng Department of Health in terms of addressing the Ebola outbreak right now.
And so, we spoke of the triage, no? So, kaya dinadala sa RITM because those
Para
that center,
centralized.
yung centralized area na yon, sila ang marunong. Sila ang makakatulong sa iyo. They can
And the equipment
diagnose.
are there.
Nandoon ang equipment.
Okay,
Yes.
all right. Doctors will talk more about the equipment. We'll talk about prevention. We'll talk about the new Ebola. Is there a new Ebola research? The Ebola vaccine trial, which
Right.
I understand. There are antibodies to fight this Ebola virus, just in case you contracted
And
this
perhaps
virus.
yung future plans natin after
Yes.
all these 3,000 OFWs nakarating na sa atin. Anong long-term plan?
Okay, we'll talk more about that, the long-term plan, and other information that we can pass on to all our viewers about the Ebola virus. More of that when MedTalk returns.
Did you know that before the Ebola outbreak in Liberia, there were only 60 doctors in the country available to contain and address the disease?
We're back here on MedTalk, still talking about the Ebola virus. Doctors, are there precautionary measures that the citizens can take so that we may be protected from this virus? Is there a vaccine, like the flu vaccine?
Wala. There's no vaccine. And in order to develop a drug, it takes about 20 years.
Okay.
Right. So, may ginagamit mga experimental drugs, yung CMAP, Brizendopir. Yung isa ginamit dun sa kay Thomas Eric Duncan, pero wala rin. Pero I think kung early on in the, yung first few na dinala sa Emory, I think they used the experimental drug na ZMapp. And then nakasurvive siya. Because I think in the early phase siya of the Ebola, ang problema kung nasa tail end part ka, even the experimental drugs hindi pa pwedeng gamitin. So right now, they're fast-tracking right now studies. Ang first na nag-declare is GSK, Glaxo.
Oh, yes.
Nasa, I think, phase 2. But it takes, years bago mapatunayan
bago
dito. And then,
ng ano.
you need a lot of volunteers dito. Lalo kung papasok sa phase 3. Phase 3 would require, let's say, 3,000. But I think if they have major breakthrough, kahit siguro 200 or 500, FDA will allow that kasi
For
these are
compassion.
drugs talaga for safety and they should actually allow it right away.
How about the Ebola vaccine trial? We hear that on the news that it was positive. There was a positive response.
Yeah, but in the early phase, there are 4 phases of the study: phase 1, phase 2, phase 3, phase 4.
Okay.
Okay, I think it's in the phase 2. Yung phase 2, efficacy and safety only in 10 to 15 to 100. So hindi pa.
Limited pa lang siya.
Oo.
Pagka sinabi yung phase 3,
Infancy of the testing this
testing pa. So you need kasi efficacy and safety studies dito. And then pag okay sa phase 2, you advance into phase 3. You need a larger sample right now. And then apply mo sa
Yung may
FDA.
mga sakit na, gagamitan mo
Gagamitan
ngayon.
mo. Then you apply to the FDA. Pag nakitang effective and safe, then dun ilalabas siya. But you need a post-marketing surveillance trial after. Kasi mamaya nilabas mo sa market, but in the larger population pala, hindi pala siya effective and
Nakaka-harm
safe
din.
or nakakasakit siya, then they have to pull out the medication.
So it will take time.
It will take time,
time.
but I'm sure with the efforts right now of the different companies plus United Nations and WHO, I think there's a silver lining, I think.
So
And I think
yes.
what we should emphasize here is because of the symptoms na nade-dehydrate yung mga pasyente, plus because of the vomiting and diarrhea, and then because of the hemorrhage, the important thing is to actually support yung hemodynamics ng pasyente. So, kailangan talaga rin yung fluids, fluid replacement, no?
So and this is
Para hindi siya pumunta dun sa phase na talagang
Is in the
irreversible.
hospital setting, what Dr. Kalimag is saying, once na-diagnose yung
Na-diagnose
Ebola
ka.
right away, then you have to do intensive care monitoring. Nandun yung fluid management mo, you have to check pag sinabing hemodynamics, pati blood pressure mo, urine output mo. Talagang ganon. Pero early on lang yon.
Wala talagang
Magandang
sa sakit
prognosis.
mismo.
But if you will
wala pa yun sa sakit.
if you will catch the disease at the latter part, ang sama ng prognosis na yun.
So parang talagang
Kaya ayaw mo siyang
siyang
makarating.
umabot sa latter part. So sa
Yes.
onset pa lang, you have
Right.
to take
Kaya ang
precautionary
dinidevelop-
measures
ang
already and you have to be
dinidevelop-
monitored.
Yeah,
No?
and then develop vaccine for this one.
Okay. So, during that period na, the patient is losing so much weight, is vomiting, what should be done? What can be done? Gagaling ba siya? Will he be able to recover from this type of virus? And if he does recover, is there a chance na mauulit siya, magre-recur siya?
60 to 80% ang namamatay eh. So,
Mortality rate is very high.
As of now, no?
as of-
Because wala pang vaccine, wala pang cure.
Basically, parang 1 in every 2 patients, ganun ang nangyayari. So it's very dangerous, mahirap. Mahirap sabihin. Kasi kahit na sabihin natin na you have the best efforts there, masyadong virulent yung virus eh. And very contagious.
Rapidly fatal, no?
Right.
It's rapidly
yun, the
fatal.
virulence. Ang
When you say virulence, talagang in your mind, there's an image of talagang attacking your entire body right away.
Yung differentiation lang yung tinatawag nila, how contagious, let's say, a virus, no? Meron silang tinatawag na RO.
Okay, what does RO stand for?
Yung ibig sabihin, that is the severity of kung gaano contagious, no? Ang classic example, measles. So in one room, you can infect 18, right? A mom's 10, right? Ganun ka. Pero itong SARS, mga 4. Itong Ebola, 3 lang. Pero ang difference, mababa ang mortality rate or death rate ng measles. Ang Ebola, kahit hindi siya contagious masyado as compared with the measles, pero ang mortality rate niya napakataas.
Okay,
So-
ito yung, I don't mean to cut, ito yung burial.
Right.
And they're not wearing protective gear.
Yes. So that's the problem kasi African culture eh. So you have to break through the barriers ng culture din. And of course, their infrastructure is not as great.
Right. Oo. Prevention and control. We've been saying since we started the program na, for those who are coming home, who have been exposed to these countries, being honest, with your point of origin. Now, how do we prevent? How do we control? How do we address this issue, this medical concern, this big medical concern?
I think walang klaro, no? But I think the DFA banning people from going back to West Africa.
The Filipinos who have come here, who are here now.
nakabalik.
Yung nandito, going there, hindi na nila pinapapunta kasi that will be a problem for them na i-repatriate sila just in case mag-escalate yung outbreak. Kasi the longer you stay in the outbreak area, the greater is the propensity for you to be infected.
Yes.
So, pag tumaas yung alert level right now, magkakaroon ng mandatory repatriation. And that's
Ang laki nun.
Ang laki ng problema ng country nun. Right?
At
So,
saka
ang
marami
ginagawa
kasi
nila
sila
right
masyado.
now, iniisa-isang pinapauwiin, ini-encourage na eh. And I don't know whether the stand of the government is after that, magta-travel ban ka pa going there, and you will not accept as well papunta rito. I think those are major decisions that the government should do after the last man out last OFW, nakauwi rito in our country.
They have, if they're not allowed to travel back to where they came from, they have, they've worked, yung
Hanap
trabaho
buhay
nila,
nila.
hanap buhay nila. But again, you know, it's for their own safety, it's for their own good, the good of the country, the good of their loved ones.
So perhaps marami pa rin sa kanila dun opt not to
We'll
come
choose
back.
not to come home. Yes,
Oo,
we'll choose not
yes.
to come back.
That is the reason behind the initiative of the DOH to have an interagency collaboration. I heard Secretary Ona doing that. Na the DFA should map out all of these OFW who are actually staying in that area para makuha. And then also the OWA and the POEA should be able to design right now job opportunities for those, right? Kasi kung hindi na sila makakapunta doon because it's a death mission actually.
Yes,
So,
yes.
totoo lang, it's a death mission. So what
Most
are
of
you going
them
to do?
kasi are
So
in
kailangan
mining
maging
areas.
innovative ang government natin with receptiveness also from the OFW that the government is doing this all in the interest of public safety and their safety as well as their family safety.
You mentioned, Doctor, no? Most of them are in the mining areas.
Yes. Most of them are in
And
the
they're more
mining
prone
area.
in those areas.
Hindi naman. Kasi usually pag nasa mining areas ka, segregated ka from the
They're not naman
communities, eh.
managing. Kaya lang, in
Kaya lang,
probability.
syempre, if the outbreak is in the area, even if you're segregated, there's a chance pa rin
Oo
that
naman.
you might get the virus. Doctors, we're out of time,
Right.
but you've educated us so much, you've enlightened us so much about the Ebola virus. Any other precautionary measures or any other advice, tips to all our viewers? Let's start with you, Doc Arvin.
I think ang dapat nating ipaintindi sa kanila, importante na ang quarantine is for their own good. They have to sacrifice a little bit, especially because it's going to help not only themselves but also their families. And this is all in the interest of public safety. So, importante yon na maintindihan natin.
Maraming salamat, Dr. Irvin. Dr. Tony,
Tatlo lang mensahe ko. Ang kalusugan ay kayamanan at an ounce of prevention is worth a pound of cure. And then for our OFWs, Merry Christmas, and of course, you are heroes in our hearts.
okay. Thank you very much again for enlightening us and educating us and helping us understand more about the government's measures, healthcare workers, the responsibilities, and the responsibility of the traveler as well.
Yes.
Again, it should be a happy and healthy Christmas for all of us. Maraming salamat.
Maraming salamat din.
See you again next Tuesday, 7 p.m. here on MedTalk, your scheduled on-air consultation on 9TV. This is Angel Jacob. Good night.